At
Message to
Tuesday's
Jamaicans living
post-cabinet
in
press
America.
briefing, Foreign Affairs Minister Kamina Johnson-Smith stressed the need for Cuban healthcare workers in the island.
We have over 400 participants from the Cuban medical program at different levels: doctors, nurses, biomedical engineers, technicians. So their presence here is of importance to our healthcare system.
It followed a statement by the United States on February 25 that it will be restricting the visas for Cubans and foreign government officials who are responsible for or involved in the Cuban labor exchange program, specifically the medical program. The rationale provided in the statement was that the policy targets forced labor. So while Jamaica has been actively engaged in the program, it's not clear whether the policy could affect the country at this time.
So this statement was received with some concern. We have been reaching out to get more information, to get greater clarity. I don't think I would be incorrect in saying that all of the members of the CUF Corps have reached out to their U.S. counterparts or their U.S. contacts at different levels, as I have. And there is, I believe we anticipate some more information to come, greater clarity.
CARICOM has since met to discuss some of those issues and going forward.
So as soon as we get more information, there is an engagement planned in short order with the CARICOM foreign ministers, the members of the CUF Corps. Also, I think, are anticipating that the U.S. embassies across the region will get additional formal information. And at that time, we should be better able to navigate the potential impact and the way forward.
Kelisha Williams, TVJ News.
Therefore, effective immediately, I am canceling the last administration's completely one-sided deal with Cuba. Our new policy begins with strictly enforcing U.S. law.
For decades, Cuba has quietly come to the rescue of Jamaica's healthcare system. In a country where hospitals are overwhelmed and the shortage of doctors is a constant challenge, Cuban doctors have been filling the gap and providing critical medical care to Jamaicans. But the truth is, without the Cuban doctors, the Jamaican healthcare system would struggle to survive. Jamaica has a long history of challenges in the medical sector. The public healthcare system is underfunded, overcrowded, and constantly grappling with shortages of medical professionals. The country's medical schools are not producing enough graduates to meet the demand, and many doctors choose to leave the island for better opportunities abroad. This has left public hospitals in a perpetual state of crisis. For years, Cuban doctors have been a lifeline for Jamaica's medical system. Over 100 Cuban doctors have been working in Jamaica's hospitals, providing much-needed specialized care in fields like surgery, pediatrics, and cardiology, and rural areas, where their services are most needed, and the Jamaican public has come to rely on their expertise, particularly in remote communities where access to healthcare is limited. The US government is stepping in with a threat that could shatter the foundation of Jamaica's healthcare system. If Jamaica continues to accept Cuban doctors, the US has made it clear that it will impose severe economic sanctions and other diplomatic consequences. The US is accusing Cuba of using its doctors to further its political agenda, and the US demands that Jamaica sever ties with Cuban medical professionals or face the consequences. The US argument is rooted in its decades-long hostility towards Cuba, stemming from the Cuban Revolution and the rise of Fidel Castro's communist regime.
Gone throughout the world since the end of World War II, this one in Cuba holds no special honors or distinctions. The revolutions have gone until this one. The Cuban Revolution is very special. It's very special for several reasons, and all of them are pretty much a mystery to this fellow, John Q. American here, who is particularly wrapped up in that Cuban Revolution. He doesn't really understand what happened in Cuba back in January of 1959. Despite the fact that no other person on this planet has a greater number or variety of ways to read about, hear about, see about, and know about things, the tons of newsprint that he's read through and the untold hours of airtime that he's listened through about turmoil and unrest and revolutions everywhere around him for years
will not lift sanctions on the Cuban regime until all political prisoners are freed. Freedoms of assembly and expression.
As part of its policy to isolate Cuba economically and politically, the US has made it difficult for many countries to do business with Cuba, including in the healthcare sector. The US sees the deployment of Cuban doctors as a way for the Cuban government to exert influence over other nations, and they're determined to stop it, even if that means putting Jamaican lives at risk. So what does this mean for Jamaica? If the Jamaican government caves to US pressure and removes Cuban doctors from its hospitals, the country faces a devastating loss of medical professionals at a time when it can least afford it. For many Jamaicans, this will mean longer wait times for medical procedures, fewer specialists available, and potentially higher death rates from treatable conditions. The truth is, Jamaica is caught in the middle of a geopolitical battle between two superpowers, the US and Cuba. While Jamaica is a close ally of the US and depends heavily on US trade and support, it also has historical ties with Cuba, especially in the area of healthcare. It's a delicate balance. Jamaica's government must weigh the economic and diplomatic benefits of maintaining a good relationship with the US against the real and pressing need for Cuban doctors. The US has long been a source of funding for Jamaican programs, including healthcare, but that funding comes with strings attached. The latest threat is just another example of the US using its economic power to influence Jamaica's foreign policy and healthcare decisions. But here's the question. What is the value of a relationship with a country that is willing to let Jamaicans suffer in order to make a political point? If the US pushes Jamaica to end its cooperation with Cuba, how will the Jamaican government respond to the pressure, knowing that thousands of lives could be at risk? Jamaica's healthcare system on the brink. What will happen if Cuba's doctors are sent home? If Cuban doctors are sent home, the consequences for Jamaica's healthcare system could be dire. Public hospitals, which are already struggling with overcrowding and understaffing, would face an even greater crisis. Patients would be left with fewer doctors, fewer specialists, and longer wait times for life-saving treatments. The country's medical infrastructure is fragile, and many Jamaicans rely on Cuban doctors to receive critical care. These doctors are not just filling the gaps, they're saving lives every day. Without them, the Jamaican healthcare system could collapse under the pressure. In addition to the medical crisis, there are economic implications. Jamaican hospitals would have to spend millions of dollars to recruit foreign doctors to replace the Cuban ones. This would put even more strain on an already overburdened healthcare budget, diverting resources away from other vital services like education and social programs. The human cost of this political battle cannot be ignored. Thousands of Jamaicans, particularly those in rural and underserved areas, rely on Cuban doctors for their healthcare needs. Many of these patients have no other option for specialized care, and without Cuban doctors, their chances of survival are significantly diminished. Jamaicans know the value of these Cuban medical professionals. They've witnessed firsthand the impact that these doctors have had on their health and well-being. Losing them would not only be a blow to the healthcare system, but also a betrayal of the trust that Jamaicans have placed in their government. The future of Jamaica's healthcare. A choice between political pressure and public health. The Jamaican government now faces an incredibly difficult decision. Does it bow to US pressure and risk the health and well-being of its citizens? Or does it stand firm in defense of its right to choose its healthcare partners? The answer is not simple. Jamaica's relationship with the US is crucial for economic stability, but so too is the need to protect the health of the Jamaican people. But now, The government's decision will shape the future of the country's healthcare system. As Jamaicans, we must ask ourselves, are we willing to risk our health for political gain?
What is really happening in Jamaica?
I was born with a rebel seed. I was a young rebel. I am today an old rebel.
That rebellious spirit is what prevents him from staying silent amid the latest geopolitical pressure being put on Cuba and its allies by the USA government. Last week, the US described the Cuban medical missions program as forced labor and outlined plans to impose visa restrictions on individuals and family members of those individuals believed to be responsible for the medical program.
I know we're not involved in any exploitation of Cuban workers. And I know that the Cubans are not involved either, the Cuban government. I know the arrangements.
Mr. Gonzalez said he is prepared to lose his diplomatic privileges over this latest USA-Cuba issue.
Does anybody expect that to go because I want to keep a visa, that I would let 60 persons from the poor and working people to die? It will never happen.
Locally, the Jamaican government says it is seeking more details from the USA on the new policy, as the matter is very concerning. Presently, Jamaica has over 400 participants from the Cuban medical program working at different levels in the health sector, including doctors, nurses, and biomedical engineers. The Prime Minister of St. Vincent and the Grenadines was speaking in Portland Sunday at a political event put on by Eastern Portland MP aspirant Isaac Buchanan. Mr. Buchanan is facing the JLP's incumbent Anne-Marie Vaz for the seat. Mr. Gonzalez also used the occasion to explain the meeting with controversial dancehall entertainer Vybz Kartel. He pointed out it was Mr. Buchanan who approached him about medical assistance for Vybz Kartel in St. Vincent, and this eventually led to the controversial meeting.
He said, Vincy Wall Boss, the Jamaican Wall Boss talking to you. As he tell me, he spoke and he came. I know a lot of persons were surprised across the Caribbean. I got calls. How you can do this? Well, I just explained to you about the book of Micah. I knew that the Holy Spirit had guided me correctly.
Dwayne Anderson, TVJ News.
Barbados Prime Minister taking a stand against USA?
And the nurses should tell us everything that we need to know. Barbados does not currently have Cuban medical staff or Cuban nurses, but I will be the first to go to the line and to tell you that we could not get through the pandemic without the Cuban nurses and the Cuban doctors. I will also be the first to tell you that we paid them the same thing that we pay Bajans, and that the notion, as was peddled not just by this government in the US, but the previous government, that we were involved in human trafficking by engaging with the Cuban nurses was fully repudiated and rejected by us. Now, I don't believe that we have to shout across the seas, but I am prepared, like others in this region, that if we cannot reach a sensible agreement on this matter, then if the cost of it is the loss of my visa to the US, then so be it. But what matters to us is principles. And I have said over and over that principles only mean something when it is inconvenient to stand by it. Now, we don't have to shout, but we can be resolute. And I therefore look forward to standing with my CARICOM brothers. I wish I could say brothers and sisters, but brothers, to be able to ensure that we explain that what the Cubans have been able to do for us, far from approximating itself to human trafficking, has been to save lives and limbs and sight for many a Caribbean person.
I just received this text I'm reading. Trump has now extended his bullying to the Caribbean.
What?
Trump told Jamaica, Barbados, Trinidad, Guyana, and other islands that they are no longer allowed to do any business with Cuba, or else USA will revoke all Caribbean U.S. visas for foreign government officials to U.S. Jamaica, therefore, cannot host healthcare workers or doctors from Cuba.
What?
Jamaica has always hired Cuban healthcare workers and doctors, and they're some of the best doctors on the island. Cubans even own and operate the nice private hospital in Montego Bay, where a lot of tourists go, far superior to the free public hospitals. Anyhow, the Caribbean is in a scurry to decide what to do, because the revoking of the visas by U.S. not only affects the Caribbean government officials, but their family members also. Jamaica and the rest of the Caribbean looks like it's buckling under this threat, because most of the government officials' children are on U.S. visas in schools in U.S. The whole Caribbean region has now to go along with the new demands from Trump. Cut all Cuban doctors, healthcare workers, and hire doctors from India, Philippines, or Africa instead. That's over 22,000 medical professionals losing their jobs in the Caribbean and heading back to Cuba. The Cuban hospital will cease to exist in Jamaica. End of documentary.
I mean, I feel like we've gone back to like 1925 or something.
Yes, I've always known of Cuban doctors all my life. They're very good doctors.
Okay, so this is my mom, by the way. You said that you've only ever known Cuban doctors in Jamaica?
Yes, all my life.
So when you hear this, what exactly does it mean to you? That's what visions come to your mind of what's going to happen now to Jamaica and the Caribbean?
Access to healthcare is going to be less, which is not good for the island. They need more, not less.
They already are in need of more right now.
Yes.
Before this has happened, and now they're going to have less, which means more
sickness,
destitution, devastation, sickness,
dying.
Disease, yes, people dying, yeah.
From medical conditions that could be treated. This is sad for the island.
Why do you think he's doing this?
Control.
Like what does it benefit? How does this benefit the United States by doing that to the islands?
It's all about control. I don't see any benefit to the United States.
So do you feel like it's just to say, I can do it, so I'm going to do it?
Oh, yeah. It's a shame because it's going to affect American tourists as well. So that's going to limit the amount of tourism to the islands, which is going to affect the economy.
Every day is something new. Every day is a new thing that we have to be like, oh, what awful thing has happened today?
It's never anything positive.
And it's never anything positive.
But this was the same as the first 4 years of Trump being in charge. He used to have highlighted days and numbered them according to what disaster he anticipated. This is nothing new.
Don't do it. Don't you dare do it, yeah? Don't cut ties with Cuba because a certain set of persons I tell we say, I try for bad way up until we say what we can do. And you have to remember say, when sickness take on eye them, a Cuba send them people them to come heal with. A Cuba I send the doctors and nurses them to every single country in the Caribbean to make sure that we are provided the services that we cannot afford to provide in in our own countries. Cuban doctors are top tier. And the best thing about it is they are getting paid. So what kind of trafficking you not talk about? I must say traffic light you must say I refer to. Because it couldn't be Cuba. Cuba was literally this with Jamaica from day one. You not gonna say you know cut ties because certain set of persons don't even provide that medical care that we need in the Caribbean. Like how Cuba just go out of them way. Cuba not even wink. Them not even wink them eye.
Top of the morning. Every day above ground is a blessing. Always remember that. So chat. Jamaicans. So I want to ask this question. Donald Trump decided that he's going to sanction US visa to every single Caribbean country who helps Cuba. Listen to me now. Donald Trump decided that he's going to sanction US visa to any country who give an hand to the Cubans. So my question is, what is your Prime Minister Andrew Holness gonna do? What will your Prime Minister Andrew Holness gonna do? Is your Prime Minister just going to abandon the Cubans just like that? Is your Prime Minister going to abandon the Cubans just like that? After they help us so many years? Huh? We and the Cubans have such good love. The Cubans come like our family. What is your Prime Minister Andrew Holness going to do? We already know that he's weak, you know. Yes. We already know that Andrew Holness is weak. But what is he going to do right now, knowing that Donald Trump put a sanction on anyone who decided to help the Cubans? Huh? He put a sanction on the US visa. So you know, say if Andrew Holness continue to help the Cubans, when they can't come to America. So, when the Prime Minister I go just abandon the Cubans just like that? Remember, you know, the Cubans are some of the best doctors around the world, you know. Remember, the Cubans are some of the best doctors around the world. What is your weak Prime Minister going to do? Huh? Is he going to stand up? Or is he going to fall? Is your Prime Minister going to stand up? Or is he going to fall? Because we already know that Andrew Holness is weak. Yes. We already know that Andrew Holness is weak. I was so embarrassed when I came to Jamaica and I saw a LGBTQ, I don't even know how to call him, a LGB flag in a Jamaica, a fly around in a Jamaica, Batman flag, eh? Batty boy flag a fly around in a Jamaica, you know? Andrew Holness. Andrew Holness, this, you know? Theme. JLP. Allow Batty boy to take over the country, you know? But now that Donald Trump asks all of the Caribbean them who they support to stop helping the Cubans, or they are going to sanction US visa to the country who helps the Cubans, what is Donald Trump going to do right now? Ask yourself that question. Because the Cubans have done so much good for Jamaicans. So is Jamaica going to betray the Cubans? because I would see that as a betrayal. Yes, I would see that as a betrayal. Yes, if I was a Cuban, I would see that as a betrayal. So, is your Prime Minister, Andrew Holness, going to betray the Cubans and get rid of them from the island? Ask yourself that question. Because like I said, you have a very weak Prime Minister running the country. Yes, you have a very weak Prime Minister running the country. But let us see what's going to happen. Yes, people, every day above ground is a blessing. Yes, every day above ground is a what? Blessing. Yes, every day is a new story. Yes, Andrew Holness is weak. Weak. Allow Batman in the country. Allow Batman in our country to take over. For it to be a norm in the country. I was embarrassed when I came there December and I saw the Batty Boy flag, the Pride flag, a fly around. Breeze a blow it up in the air. Embarrass people. I am not telling you to go vote for PNP, you know. No. But Andrew Holness definitely not it. No. Andrew Holness definitely not it. But every day above ground is a blessing. I'm out.
So the US is putting sanctions on any country and restrictions on any country that is working with Cuban health workers, right? Now let me tell y'all something, okay? As of intention, right? And I know for a majority of other CARICOM countries, Cuba plays a vital part in the health of the Caribbean. Cuba has some of the best medical care, but if you didn't know, the doctors and the nurses from Cuba will actually work in other Caribbean countries. So they work at one of our centers that do like hemodialysis. That's something that we can't offer, without them. We're a small country. And even they'll perform like eye surgery, other surgeries as well for doctors or specialists that we may not have. There's a Cuban doctor that may be able to offer that, right? And I know Trinidad works with them as well, Grenada works with them as well, Jamaica works with them as well. And so the US has basically said, okay, if these countries continue to work with Cuba, we're going to take away the visa of the prime ministers. So they can't come to the US or whatever. And basically, the prime minister, the PM of Barbados, shout out my girl, and the comrade, Ralph, okay? They were like, okay, well, you do what you gotta do. We're going to do what we gotta do. But we're not going to stop relations with Cuba. US is wanted to say we trafficking the people. This is a partnership. Just because you and Cuba they don't like each other, that don't have nothing to do with us. And for us, for the intentions, like, we actually get like a couple medical scholarships a year for our students to go to medical school in Cuba. They have to like learn Spanish and stuff. But basically, I love that the Caribbean is standing up. They're like, listen, you do what you gotta do, friend, but we are not stopping relations with Cuba. So basically, Trump and them trying to threaten the Caribbean, and the Caribbean is like, you about to learn something today. And Ralph? Okay. Ralph, yes, stand on business with this. We talk about this specifically, okay? Everybody, stand on business.
Look here, I have a concern. And I don't business what nobody want to say. I don't care what nobody want to say. Me no busy what no want to say. Me no busy what no want to do. If you no want to say anything about me, I want to say it. But I agree with Donald Trump. All Cuban doctors should go back home. Send them back at them yard. You understand? I'm a reason why I say this. When I was a child growing up, and even before I was born, Jamaica government used to employ Jamaican citizens to be doctors in the country. And you could have find baby born up to 5 months old and live. 6 months old pregnant belly and the pitney live. You understand? Man go hospital for all 10 gunshot and live. People drink all poison and go there and live. Nowadays, woman have baby at 7 months old and the baby them not live. Premature baby not survive a hospital again like one time. You understand? If you go hospital now for your finger injury, then cut off your foot. You go there with a toothache and then cut out your organ. Cuban doctors are not here in Jamaica to help Jamaicans. They are here to make money. It's all about the money. So I believe that they should send them back home, employ young Jamaicans. Employ young Jamaicans. There are a lot of educated Jamaicans who go to college and coming out of school right now. Many of them would love to become a doctor, but what? They are not getting the opportunity. Because there are 10 Cuban doctors to 1 Jamaican. When I go to hospital, I be a white Cuban people me see. Most of them don't treat Jamaican good. Them not treat the baby mothers them good. Them not treat them good. When last you guys have some family member or so go to the hospital and them don't make it out? These things are the number one of the big contribution to the death that's going on in our hospital. Think about it for a second. So much people never used to do the hospital until them taking all of these Cuban doctors. You understand? So yeah, we are going to say Donald Trump never said that, yes, but who knows? Okay, I'm gonna work out in one way so we can help, so we can employ our own Jamaicans. There are a lot of young people right now graduate from school would love to become a doctor, but the field is so packed with foreigners. Employ Jamaicans. The government of Jamaica need to employ Jamaicans. I need to, when I walk into the hospital, I need to see Jamaicans doctors. I'm tired of seeing these white people. They do not talk to us good. They not treat enough of we good. But some people who don't know about it, them only come and attack all these things about Lord the Cuba. Yes, we want the Cubans to live and want them to survive. And they'll be our partners. But on every partnership good. Train your own countrymen and women them. Alright then, since I don't know how to send them home then, start to put things into place from now. Send some young Jamaicans, some young graduates to go among these Cubans to learn what they're doing. And take the ideas. And employ our own people them. But we cannot continue just to take foreigner doctors in the country. So and then suppose Cuba call back for them doctor. The whole Jamaica get knocked. It's better to send them home and employ on own people them. Let them take time and learn. You understand? But too many people dying in the hospital. Too many pregnant mothers losing them baby because the doctor them don't know nothing. Enough of these doctors them don't know nothing. And them know something but them just do not love our people them. So when you come after me if you know I don't give a shit.
When me look up my eye and me go a doctor something that 7th Avenue. Imagine say me get one Cuban doctor cause them are the best.
But never say something to know, Mama. When him sell out the Cuban doctor them now, what kind of doctor we have a Jamaica?
Alright, because him go sell out the doctor them, me no know, we know. Cause guess why? You see, anybody are do good for Jamaica, I look like them not like when nobody help Jamaica. Me no talk politics, you know, me no do politics. Ask she ever see me I no meeting, nothing. Me no believe in that, me no talk politics. Cause me I tell them, say them no do nothing for me. But the end of the day, you see the people them who help Jamaica, look if them don't go, just look into it.
True. true. Right now, mama, right
Oh,
now.
you fi sell out a cube, we, the doctor them we are help,
We are save life. We are save life.
Them do them working everywhere in the hospital.
Everywhere.
Every part.
Me say woman have difficulty if you have baby and them see woman save baby and save woman life. And you want to shoot them out, brother.
You want to shoot them out. If you left Jamaica people for suffer. That's why the rich shall be rich.
Just because
they don't
sweetness and money.
And we are going to put politics beside. We are thinking about the people of Jamaica. We're not talking about PMP or Labour, right? But
we're talking about everybody.
Yeah. What is it, you know? Everything we are talking about people are feeling, you know, but the labor right, them just bias and wicked to themselves and wicked to the people them because they are, me know a whole heap of labor right. Sign up for go see a Cuban doctor for them ear, them ears, them body, and when the ear said this happen to the Cuban doctor, them and none come out and say, Mr. Andrew Wallace, you cannot do this.
What am I going to do to the Cuban doctor? Don't give them the visa and send them back.
No, Chum tell himself to send them back to Cuba. Or
shoot them out of country.
Visa. Take them out of Jamaica land we love. And look how long them did. Cuban
but
them.
But I don't think Andrew's a fool for make Chum stay foreign and run Jamaica.
No, sister can't love money.
Him don't collect the money already. Him don't come up here come collect the money already. The way him love money, everywhere him go collect money for sell out Jamaica. All them say PJ a Batman. PJ never put up the gay flag at embassy. And Andrew only raise it. At them and say the people for them and say for pull out the gay flag where Andrew only take the money for put up. And the people them come out and talk say them get Andrew only $1.5 million US for him. Yes.
I wish she there. Why you there, mama? You're behind time. Wake up, man. Wake up, man.
Overall, the man so disgusting. The man take money.
Look here, sir. As much as me live here, you see when me see politics things or whatever, me not really listen or whatever. Me tell somebody the other day, so when me small and I grew and me got that country, my grandmother, she's putting our head, don't go a road and talk politics. When you hear people talk politics, don't be a dummy. So he grew up in a me, for don't go a road. Remember, yeah, man.
I'm going to say something to you, Oprah. I'm going to say something to you. You know, say, China bring in a lot of things in Jamaica, though.
Yes.
All right. And you know, say, Jamaica are owned by China.
Hey, look here, at the last week, me tell somebody, say, all right, which part me live right now, you see? If the next, me put it by the next year, me can take 5 minutes from where me live, go up in the town. Or less than 5 minutes. And you see, when China start buy out everywhere on a bill, I remember say be a vehicle card. Yes, I never bill for so much. Nobody never knows saying all that I go get populated. So and then sometimes it take me all 1, 2, 3 hours to reach up in the town. Me have to start walk if me not have nothing. You hear me say? And everywhere you see sell out now, a China buy it out. China. No building not that all over hardly. We're not China in a. You see which part Scotia Bank did there? Right now, no Scotia Banks so that all over. Any business you have to do a Scotia, you have to go Maple or Spanish Town or Kingston. Because right where bank did there, as China big old supermarket.
Oh yeah, so that right I can't this away machine.
Right there, so. When me say right in front of the police station, me say when you go down look a bit more, but one family place that when you look at China bite and big China restaurant, you not have no way.
They not buy out the ice factory yet.
Opal. When you look on it, Opal, water in Jamaica, the land of food and water.
Food and water.
Let me show you where I'm going. Because you don't do politics, but you have to stand for something district. Yes, if you go vote, you go vote for something for your people, them your generation district, because this government need to come out. Water, Jamaica is the land of food and water. And when you look for Andrew Owens, them import ice to Jamaica. Import ice.
All along, go and carry them the ice come here, Jamaica, ice I see the way melt.
And the ice factory where they are out here, they don't have country there. Carry ice at Kingston to sell and for go back at Kingston with them ice, so the ice factory make Andrew Owens them have them contract with them import ice in Jamaica. One bag of the ice at $1,000 for that bag of ice there. I remember say you have only per man, we have them look at ice, something with them machine.
We say ice at 200 and 300 and
all right.
something.
For sure you all this man and have nothing for do for the poor and needy, the rich and greedy. Them get contract for import ice, poor pal. Ice, the leastest thing I show you. Ice.
Ice when you put it if you not keep it on. No way you do it melt.
So when you hear people talk, it's not because do politics, but you have to listen sometime and what go on in your country because your country have go down to nothing. And the man them a tell lie to the people them, say the country in a crisis right now. The man them a